Focusing on you. Innovations in modern medicine. From your team of experts at UHealth, the University of Miami Health System.
A 30-year career in law enforcement began to take a toll on Reynaldo Segui's left shoulder.
I couldn't move it up to a certain position, and then it would hurt. It would be a constant hurt.
After years of living with the pain, Reynaldo went to see Dr. Julianne Munoz, an orthopedic surgeon at UHealth Sports Medicine Institute. She recommended total shoulder replacement.
A total shoulder replacement is a surgery that's used for arthritis of the shoulder joint. That's a ball and socket joint. So when we replace it, we usually are cutting off the humeral head, which is the ball component, and we replace that with a metal ball.
Then Dr. Munoz replaces the arthritic socket with a plastic component.
And so that gives you a nice new, painless and better moving surface than an arthritic joint.
So, doctor, who's a good candidate for that?
Anyone that's kind of in the 60s, 70s range is really a prime target because they're going to get really great relief.
I would imagine there's physical therapy as well. Does that start concurrently while the patient's in the sling, or you wait till the sling period is over?
Exactly. So physical therapy is really imperative to making sure that the total shoulder replacement function actually is maximized. And most patients will start their physical therapy sometime between a 2 and 4 week period after surgery. And patients can be back to, a lot of their desired activities on the tennis court or the golf course somewhere between that 4 and 6 month range.
She says there are signs you may want to consider total shoulder replacement.
Not being able to lift up your grandchildren or not being able to get your hand to your head.
Talk about why UHealth is uniquely positioned to help patients.
Shoulder replacement surgery can now be done in our Lennar Medical Center, which is our state-of-the-art day surgery, 23-hour observation hospital in Coral Gables. And it has really just made for a very nice, smooth patient experience.
2 months after surgery, Reynaldo was gardening and working on the house again. He credits the entire UHealth team for getting him out of pain and back to doing what he loves.
They're fantastic.